check the doctor's order on the patient chart. So this is done to identify the drug's name, dosage, route of administration, time to be given, and what kind of drug to give the patient. Prior to performing the procedure, introduce self and verify the client's identity using agency protocol. So this is to explain the procedure to the client and how he or she can participate during the procedure. So this is to ensure if you are meeting with the right client and to get consent to the right to give medication to the patient and ensure that the patient knows what and how the procedure will be going. So good day, I'm Hezia Michael J. Velasquez, your student nurse for today. May I see your wristband, please? Please state your full name, age, and birthday.
Hezia Velasquez,
Age, please.
19,
And your birthday, please.
November 19, 2007.
Thank you so much. Okay, so as in accordance with your doctor's order, I will be administering intradermal, subcutaneous, and intramuscular injections, okay? Later on, I will be asking you to move or switch positions. Are we clear?
Yes.
Perform hand hygiene and observe appropriate infection prevention procedures. So we need to perform hand hygiene to deter the spread of microorganisms and to prevent contamination. Next, we need to arrange the medication card. As you can see here, this is the medication card given. And the hypodermic tray. So with the corresponding drug, we need to arrange the hypodermic tray to ensure efficiency. So the materials that we will be using are the improvised hypodermic tray, as you can see here. 1 cc or 1 ml for the intradermal injection. 1 insulin syringe for the subcutaneous injection, and a 3 cc syringe or a 3 ml syringe with a 23 needle gauze. So this is for the intramuscular injection. And next is the aspirating needle to withdraw the medications. Next is the 10 ml sterile water vial. Cotton wool soaked in 70% alcohol, band-aid to cover the injection site later on, forceps to withdraw the 70% alcohol to avoid contamination, and eggplant, and lastly, the medical gloves. And of course, we can forget the waste receptacle. So this is for the used syringe, needles, band-aids, and the cotton balls. Prior to performing the procedure, introduce self and verify the client's identity using agency protocol. So this is to explain the procedure to the client and how he or she can participate during the procedure. So this is to ensure if you are meeting with the right client and to get consent to the right to give medication to the patient and ensure that the patient knows what and how the procedure will be going. So good day, I'm Hezia Michael J. Velasquez, your student nurse for today. May I see your wristband, please? Please state your full name, age, and birthday.
Hezia Velasquez,
Age, please.
19,
And your birthday, please.
November 19, 2007.
Thank you so much. Okay, so as in accordance with your doctor's order, I will be administering intradermal, subcutaneous, and intramuscular injections, okay? Later on, I will be asking you to move or switch positions. Are we clear?
Yes.
Okay, thank you so much. Afterwards, we need to choose an injection site free of lesion, discoloration, and you select the side 3 to 4 finger with below the antecubital space and one hand above the wrist. So we need to check for the lesion and discoloration to find out the best injection site to avoid having internal and external problems. Okay. May I see your other arm, please? Okay, so we will be using your right hand in conducting the intradermal injection. Is that okay?
Yes.
Okay.
Yes.
Afterwards, we need to position the patient's arm so that his elbow and forearm are supported in a flat surface. The arm should be in a relaxed position since when it is flexed, the injection or shot can be more painful or the patient can feel hurt more. Okay? Can you relax your arm? Don't flex it. Now let's move forward to the intradermal injection. Firstly, we need to apply clean gloves. We can use an antiseptic swab to clean the site beginning at the center in a circular motion upward about 2 inches or 5 centimeters. So this is to remove the bacteria from the skin and to avoid cross-contamination and contaminating the needle and medication later on. Next is we need to remove the cap and hold the syringe between the thumb and forefinger of your dominant hand with the bevel of the needle pointing up, since your dominant hand is your most used to and to provide more force and support. So my dominant hand is my right hand. I'll be using this. First, need to remove the cup and point it up. Afterwards, we need to stretch the skin taut at the injection site by pulling gently with the thumb and forefinger at your non-dominant hand. So this is to avoid pain and to support the needle goes in smoothly and pulls tissue away from the muscle, making injection easier. Okay. Afterwards, we need to pull the needle very closely to the patient's skin. Insert it slowly at 5 to 15 degrees angle until you feel the resistance. Advance the needle up to the epidermis about 3 millimeters. So firstly, we need to clean the injection site so I don't have any antiseptic swab. I will use 70% alcohol instead. A circular motion. And we need to throw this at the receptacle bin. Slowly inject the medication and feel the resistance until you see a bleb that resembles a mosquito bite will appear on the patient's skin. If it does appear, it means that all solutions are in the intradermal tissue. Okay. Before that, again, we need to clean the injection site and circular motion. Okay, inserting the Okay, afterwards we need to withdraw the needle at the same angle it was inserted and pat dry cotton ball. Do not massage the area. Okay, withdrawing and cotton ball. Okay, encircle the wheel with the blue or black pen and instruct the patient not to rub the wheel or erase the mark. Okay, as this, I'm going to mark the injection site. Please don't rub it or scratch it, okay?
Yes.
Assist the patient to a more comfortable position, indicating the site due to time reading. Okay, so exactly 10 a.m. Okay, are you in a comfortable position?
Yes.
Okay. Don't recap the used needle, discard the needle and syringe to appropriate receptacle. Wash hands and document the procedure. Interpret the result after 30 minutes to avoid mixing the used needle with the unused to avoid contamination and confusion. Wash hands to remove bacteria and germs, and this is to have legal documentation of what was assessed, of what assessment was done to the patient. Okay, we will throw this at the receptacle bin. And now let's document. Now let's move forward to the subcutaneous injection. Firstly, we need to check the doctor's order on the patient's chart. So this is done to identify the drug's name, dosage, route of administration, time to be given, and what kind of drug to give to the patient. And prior to performing the procedure, we need to introduce self and verify the client's identity using agency protocol. So this is to explain the procedure to the client and how he or she can participate during the procedure. So this is to ensure if we're meeting with the right client and to give consent to give the right medication to the patient and to ensure that the patient knows what and how the procedure will be going. Again, we need to perform hand hygiene and observe appropriate infection prevention procedure. We need to perform hand hygiene to deter the spread of microorganisms and to prevent contamination. Good day, I'm Isaiah Michael J. Velasquez, your student nurse for today. May I see your wristband, please? Please state your name, age, and birthday, please.
Leslie Velasquez, 14 November 19, 2008.
Okay, thank you so much. So today, I will, in accordance with your doctor's order, I will be administering intradermal, subcutaneous, and intramuscular injection. Okay? And I will be asking you to move or switch positions. Are we clear on that?
Yes.
Okay, thank you so much. Afterwards, we need to discuss with the patient the purpose of each medication, its action, and possible adverse effect. So this allows the patient to ask questions and find out the last injection was given in order for the patient to have knowledge and information about the prescribed medication. So given its purpose and side effects. So Hazli, today I will be administering you, as instructed by your doctor, your insulin. Okay, so when was the last that you were given medication?
10 a.m.
Okay, thank you so much. So afterwards, we need to determine which site you will use. We need to shift the patient's bed linen to expose only the potential injection site, inspect the area for bruising, inflammation, and edema, again to avoid any bacterial or contamination affecting the medication and syringe. Best site are located at the outer aspect of the upper arm, the abdomen, below the costal margin to the iliac crest, or the anterior aspect of the upper thigh. Okay, so Hazli, may I cover your lower extremities to make them more comfortable? Okay. Only exposing the part that needs to be injected. May I open your cloth and exposing your abdomen? Thank you so much. Okay. Palpate the site to avoid any area that is tender. To make sure that you have the right size needle, use your thumb and forefinger to grasp a skin folder tissue at the injection site. Measure the fold from top to bottom and check to ensure that the needle is about half as long to avoid the patient experiencing pain. Okay. So let's create a skin fold just like this. Palpating. To see if there's any tenderness. Okay, thank you. Place the patient in a comfortable position and ask the patient to relax the area you're about to inject. To ensure the patient is calm and to remove anxiety. Okay, Hazli, I want you to stay calm. Okay, I will be injecting here at your abdomen. Okay, so to avoid you getting anxiety. Okay, so this is the area that I will be injecting. Okay?
Yes.
So I hope you can relax. And are you in a comfortable position?
Yes.
Okay. Next, we need to apply clean gloves and clean the site with an antiseptic swab in a circular motion, starting from the center outward to avoid cross-contamination and bacteria. Okay, so Hazli, so I didn't have an antiseptic swab. I will be using a 70% alcohol cotton ball. Okay, so I will be cleaning the injection site here in your abdomen, okay? Circular motion. And you need to throw this at the receptacle bin. Afterwards, we need to remove the needle cap by pulling it straight off. Hold the syringe between the thumb and forefinger of your dominant hand as you are holding a dart. Again, use your dominant hand since this is what you're most used to and provide more force and support. But before we do that, we first need to glove to avoid cross-contamination. Afterwards, we need to insert the needle firmly at 45 to 90 degree angle and release the pinch skin. Rest your non-dominant hand on the patient so this to create a skin fold and again pulls away fats from the muscle and to prevent feeling pain. Okay? hold the syringe like you're holding a door, just like this. Okay. Afterwards, we need to move our dominant hand at the end of the plunger and slowly inject the medication over several seconds. This is to retain your grasp on the syringe to keep it still. Okay. Quickly withdraw the needle, place a swab or gauze pad on the site and apply gentle pressure but don't massage. So this is to avoid intended absorption patterns. Again, using a cotton ball soaked in 70% alcohol. Afterwards, need to close the injection site. Close the injection site by covering it with place the patient in a comfortable position and document the procedure. Record the time and amount of drugs on the medication sheet. So this is to have a legal documentation of what was the assessment done to the patient. Okay, so Hazli, are you in a comfortable position?
Yes.
So, okay, time is 4 a.m. Now let's move forward to the intramuscular injection. First, we need to check the doctor's order and the patient's trust. So this is done to identify the drug's name, dosage, route of administration, time to be given, and what kind of drug to give the patient. Next is we need to, prior to performing the procedure, we need to introduce self and verify the client's identity using agency protocols. So this explains the procedure to the client and how he or she can participate during the procedure. So this is to ensure if we're meeting with the right client and to get consent. So the right to give medication to the patient and to ensure that the patient knows what and how the procedure will be going. Good day, Mr. Fitness for today. My name is Azia Michael J. Velasquez. May I see your wristband, please? Please take your name, age, and birthday.
Ligas case 14, 19
Okay, so in accordance with your doctor's order again, I will be administrating the intramuscular injection to you. So I'll be asking you to move or switch positions later on. Are we clear? Okay. Afterwards, we need to perform hand hygiene and observe appropriate infection prevention procedure. We need to perform hand hygiene to deter the spread of microorganisms and to prevent contamination. Afterwards, we need to select an appropriate site for the injection. The vastus lateralis or the deltoid muscle are possible site for the intramuscular injection. Make sure to avoid the dorsal-gluteal site. Okay, so Hazli, may I ask if you can turn around? Okay. I'll be exposing you. Okay. Afterwards, we need to examine the intravertebral amount of the patient's muscle mass and palpate the muscle area of tenderness and not suitable for injection site. So this is to decrease the risk of hypertrophy, and we need to inspect the area for bruising, inflammation, edema. If the skin shows bruising or inflammation, we need to use other sites. So this is to avoid the small blood vessels that accidentally damage, leaking into the surrounding tissue. Okay, I don't see any bruising or inflammation. We can use this side. Afterwards, we need to have the patient in a more comfortable position to accommodate the injection site you've chosen. Expose only the portion of the body to inject smoothly without any hindrance or hassle. Lastly, I will cover in your lower extremities. Make you comfortable. Are you in a comfortable position? Are you in a more comfortable position?
Yes.
Apply clean gloves and use anatomical landmarks to find the site. Again, for the ventral injection, place the heel of your hand over the great puncture, just like this, of the patient's hip with the wrist almost perpendicular to the femur. Okay, point the thumb towards the patient's groin. Point the index finger to the anterior superior iliac crest, iliac spine, and extend the middle finger along the iliac crest towards the buttocks. The index finger, middle finger, and the iliac crest form a V-shaped triangle. So the injection site is the center of the triangle. We need to determine accurately to get the injection site for the intramuscular. Okay, just like this. Afterwards, we need to disinfect the injection site in a circular pattern from inner to outer for about 2 inches to remove the bacteria and avoid contamination. Afterwards, we need to hold the gauze pad between the third and fourth finger of your non-dominant hand. Okay, since I don't have any gauze pad, I will just be using again a cotton ball soaking 70% alcohol. We need to slowly set this up with the lid. Afterwards, we need to remove the needle cap by pulling it straight off the syringe with the thumb and forefinger of the dominant hand as you're holding the door to prevent the needle from touching the side of the cap and prevent contamination. Okay? Afterwards, we need to place the ulnar side of your non-dominant hand just below the injection site and hold the patient's skin tone laterally about 1 to 1.5 inches and hold the position until you're inserted the needle. If the patient has a little mass, grasp the body of the muscle between your thumb and forefinger. Your dominant hand quickly pierce the muscle at a 90-degree angle. The skin continue to pull the skin taut with your non-dominant hand. Okay. Afterwards, we need to aspirate the syringe by pulling back the plunger with your dominant hand. If blood appears, you're not in the muscle. Remove and discard the needle and syringe and start over. If no blood appears, proceed. Inject the medication slowly at the rate of 1 ml at 10 seconds, and wait for 10 seconds and smoothly withdraw the needle. For 10 seconds. Release the skin and place a gauze pad on the site. Apply gentle pressure but don't massage the area, okay? Place the patient in a comfortable position so to avoid getting a mixed pattern distribution, okay? Again, since I don't have a gauze pad, I will be improvising by using a cotton ball, so in 70% alcohol, and then throw this at the bin. So afterwards, you need to cover the injection site again. Okay. Afterwards, we need to document the procedure to have legal documentation of what assessment was done to the patient.